Many people will agree that depression is a very serious and dangerous condition to have. A lot of lives have been lost due to this mental illness. A lot of people will also agree that they do not know what depression is, how to differentiate between depression and stress. To give us more insight on the topic, we're speaking to Dr. Williams, who is a psychiatrist at the Serenity Clinic in Observatory.
Clinical depression, or major depression as we say, is what we call a syndrome. And a syndrome is where there are many different things that occur together. So I might have a low mood, I might notice that my sleep is affected, I'm sleeping poorly, my appetite is decreased, my libido or appetite for sex may be decreased, my concentration is decreased, I might have feelings of guilt or shame, and I might have suicidal thoughts, and this is a very important symptom that we look at because we obviously don't want the person to harm themselves. And I might even have pains in and around my body. So when you see all of these symptoms together, and we look over a time frame of at least 2 weeks, that's when we're thinking, we might be looking at clinical depression.
We also spoke to a fashion designer who goes by the name of Vox Bolo, who has a fashion range titled Depression is Real. I've experienced it myself.
So I was one of those people that were going through depression, and then no one supported me at home because no one would understand this kind of behavior. So it was crazy. It was crazy to even talk about it. The only way that you deal with depression is to talk about it. And what's crazy now is that the youth, they don't talk about it. That's the thing, they don't talk about it. They use cocaine as a cure for depression.
Just chatting to people that you can trust, it can help you, or a little bit of talk therapy. But in moderate or severe depression, that's when you're going to require medical treatments as well. So in terms of where do you get access to treatment? In the government sector, the best place to go to is your community healthcare center.
I'm trying to save lives because that's the only thing that matters at this moment. Like a lot of youth, they're going through depression, they're committing suicide. If you check at the rate of UCT students that are committing suicide because of depression, it's crazy, it's high up. So I feel like as a black, I'm trying to educate the black society about what is depression.
People's lives have been saved by a kind word, by a colleague expressing concern and saying, listen, why don't I give you the number of the clinic or my counselor or my psychiatrist? So we see lots of suicides in our setting, and it's very, very preventable. In South Africa, we have the highest levels of femicide in the world. This is where the person not only takes their own life, but they kill their partner, they kill their children. So it's very, very important that we pay our minds to look at the risks of suicide and femicide.
A kind word to a loved one or colleague can make all the difference from your side. Kanya Lumgwana, Our City News,